Hey guys, Mike here from nursing.com. And today I want to go over some of the practice questions. Well, we're going to do some practice questions, but questions that you're going to see on the NCLEX. Now, I will say I got these straight out of the NPQ, the nursing practice questions, off nursing.com. And the way you can get to that is when you log into the website, which you will all do. Right at the top of the page is a couple of tabs. One says practice questions. Click on that. That's going to bring you to the NPQ. Now, this is really cool because you can basically make your own practice quizzes. So I would choose NCLEX type test, because that's a choice. Then you can choose the length of the quiz, 5, 10, I think 25 or 50 questions. You can then choose from like nursing topics, and there's probably like 20 of them. Or if you scroll down a little bit, you can choose the NCLEX topics. And one of our other videos talks about what the NCLEX topics are. And I believe there's 8 of them. And you can select all of them. You can select one of them, whatever you want to work on. You can select that. Then you can select the type of format. So you can select all that apply, alternate format, or regular multiple choice. And then you can select the difficulty, depending on how froggy you're feeling. Easy, medium, hard. So let's get right into it. Let's do a couple quick practice questions. Got my notes, as always. So, yeah, let's do this one. This was in the management of care topic. So, stay with me. A 7-year-old child, by the way, yes, you will get pediatric questions on the NCLEX, right? Some people think, oh, we just take care of adults. No, we do peds too. So, brush up on that stuff. So, a 7-year-old child was brought into the emergency department with 2nd and 3rd degree burns over 36% of their body. What is the priority? We talk about those important buzzwords. Priority during this initial emergency department phase in caring for the client. So what's the priority of this kid who was burned on 36% of his body? So our choices are pain control, promote normothermia, debridement of the wounds, or fluid resuscitation. Now this is something you're going to have to know. What is the priority for a kid like this, for a pediatric patient with 36% body surface burns? And the answer is fluid resuscitation. Right? And the reason, and it's nice because when you select the answers after you're done with the quiz, it gives you all the rationales as to why the answer is right and why the answer is wrong. So fluid resuscitation, basically any surface area over 20%, they're at high risk of losing fluid, right? They can go into hypovolemic shock. Top priority is to begin fluid resuscitation, and it talks about the Parkland formula, which I'm not going to get into. Look it up, Parkland formula for fluid resuscitation. Also, a lot of people on this one have chosen normothermia. They think that with burns, you get cold. Now, and what it says here is, though it's important, it's not the most important initial intervention. All right, we talk about stuff like that. All right, let's move on. I like this one. Let's go to pharmacological and parenteral therapies. I got one question. I like this one. Yeah, okay. So, a client is prescribed a selective serotonin reuptake inhibitor, and the nurse knows that the benefit of taking an SSRI over other antidepressants is which of the following? An SSRI is the most effective antidepressant available. An SSRI only affects one neurotransmitter instead of several. An SSRI does not cause unwanted side effects. And an SSRI is less expensive than MAOIs and tricyclic antidepressants. Okay, so we're going to eliminate these. This is one of those questions where even if you don't know the answer, this is where that educated guess part comes in, right? So let's think about it. So, an SSRI does not cause unwanted side effects. Come on. Every medication can cause unwanted side effects, especially psych drugs. Throw that out right away. Come on. No side effects? Get out of here. SSRI is less expensive than MAOIs and tricyclics. I'm a nurse. I'm not a finance guy. I have no idea what medications cost. That's just me. I'm throwing that one out. So then we're down to it's the most effective antidepressant or it affects only one neurotransmitter. Okay? So you think about this, selective serotonin reuptake inhibitor. Selective serotonin, well, it's selecting serotonin. That's only one neurotransmitter. Well, what are the other psych drugs we have? We have tricyclics. Well, tricyclics, that's 3, okay? And then we have MAOIs, and I don't know what those do, but I think those affect a bunch of things. So I'm going with that, right? Because I'm taking an educated guess saying selective serotonin is one neurotransmitter. I'm going to go with that, and it is the right answer. And the reason being, tricyclics affect 3 things. Norepi, serotonin, they affect norepi and serotonin. MAOIs affect norepi, epi, serotonin, and dopamine. SSRIs, which are selective serotonin, affect only serotonin. Okay, you see how we got to that? All right, let's do one more. This actually was listed as an easy question, so let's see how many of you get it. So, the nurse is assessing a client with AFib, atrial fibrillation, and notes weak, thready pulses, cool extremities, and complaints of fatigue. Which of the following is occurring? First of all, I'm calling a rapid response. Let's just go with that. Okay, anyway. So our choices are, the following is occurring: increased stroke volume, increased contractility, decreased afterload, or decreased cardiac output. Now, let's look back at the question. We've got weak, thready pulses, cool extremities, and fatigue. Well, what do we think is happening? Increased stroke volume? Well, increased stroke volume would mean more blood. Same thing as increased contractility. If we had increased contractility, that means the muscle of the part is pumping harder. We shouldn't have a weak, thready pulse. We should have a bounding pulse. All right, well, decreased afterload. Decreased afterload, that's the blood coming out of the heart. Well, if that decrease, that could be, maybe. But decreased cardiac output. Thready pulse, the periphery is not getting perfused, and the patient's tired. Yeah, they're not getting blood to where it needs to be. Decreased cardiac output. All right? Client is demonstrating signs of decreased cardiac output. Cardiac output means that a low amount of blood is being pumped by the heart. Well, that's what I just said. So the tissues are starved for oxygen. Signs and symptoms of low cardiac output include diminished pulses, weak, thready pulses, hypotension, cool extremities, and fatigue. Ta-da! So, those are just a couple of examples of the type of questions you're going to see. I think one of them was medium, one was easy. I highly recommend you hit up nursing.com, you go to the practice questions, you go to the NPQ, and you start banging out questions, guys. Read the rationales. When you finish the test, it gets a pop-up window with all the questions you just did, and you can go through all the rationales into the whys and the rights and wrongs. I highly recommend that not only do you read why it's the right answer, but you read, if you got it wrong, why the wrong answer is wrong. And if you do that, you guys should be good to go. All right, guys. Thanks very much. I'm glad you joined me today, and I'll see you on the next one. Hey, guys. So I hope this video helps you in your nursing journey. Now go out, be your best self today, and as always, happy nursing.